Hello, this is Dr. Do again. This video is continue with the systemic approach of medicine. I have talked about the diseases associated with this invisible structures like 4 major organic compounds and cells, and also move on to the level of tissue which is visible, and talk about the diseases start from epithelial diseases associated with epithelia. Oh, by the way, the medical term a lot of times, the ended with the letter U and M, referring to the single form, but if it's a plural, will become A, like epithelium. It's one individual epithelial cell, but if you talk about epithelia, which means group, plural form. So anyway, so start with the diseases associated with this epithelia. Talk about the internal organs, lining structures. Actually, this epithelia lining in a lot of structures. And today, for example, I'm going to talk about the other two important diseases associated with this epithelia. One is the epithelia on the esophagus. You know, you have probably the GERD. You have heard a lot of this term, like gastric esophageal reflux syndrome disease, which means the continent of the stomach flux back to the esophagus, esophageal epithelial cells. If it is a long chronic process, this will be leading to a condition which is precancerous. Why? Because of those changing the environment of those local cells. So those normal cells of the esophageal is similar as our skin, but will be transformed into the epithelial cells similar to the stomach, which is columnar cells, instead of the stratified squamous cells, which is similar as the skin and the esophagus. So this is called metaplasia. This process is called, in the medical term, called metaplasia, because it changed the original form of cells. Even though it's not cancerous, but it's a pre-cancer condition, because those the cells was not from the original place in cyto, but changed to the other type. So eventually, if this going process will increase the risk of the cancer. So this is a very important, another important and very common conditions associated with this epithelia. And there are different kinds of epithelium, the shape or the layers, either simple or stratified, or the flat like a squamous, or the cubic, or the columnar, or the pseudo stratified. There is so many varieties. Those are the term really, the medical. But another important disease I can think associated with this epithelial tissue or cells is in the kidney. Kidney, the parenchyma cells of the kidney actually is the tubule cells, which is cubic, like square-shaped, very well organized, aligning on the surface of the kidney tubules, from microtubules to the visible tubes. So these are the actually the microtubule structure. Those are the parenchymal cells of the kidney. They carry on the functions, even though the glomerulus are so important. That's the function unit, including glomerular and also the tubule. This can start to get together as a function unit, nephron. But the glomerulus really formed a global structure of the capillary, if you recall. So these also have the epithelial cells. I'm talking about that later. But now talking about the parenchyma cells of the kidney, which are the tubule cells. If those cells are not function well, either from the chronic infection, or from the chronic kidney disease, or from another autoimmune condition or systemic diseases, if those cubic epithelial cells not function well, which means the kidney tubule will not carry on the major function to absorb or to excrete the waste, and also to absorb the nutrients, including the irons and also the proteins. So if that's the case, there are different kind of the tubule caused acidosis, majorly impaired function to excrete hydrogen, so cause accumulated of hydrogen in the body. So this is another disease associated with this epithelial. It's so sounds like a remote or sounds like so not medical, but it is a medical condition. And talking about the glomerular disease, of course, if the glomerulus, like I said, capillary global structure of capillary wrapping together. So if that endothelial cells coating on those capillaries lost the function associated with the connective tissue, like formed the basement membrane, either by the inflammation, toxin, or autoimmune reaction, if that membranous structure and also the cells is not function well, so this causes the glomerular problem, either the nephropathy or nephritis, or the glomerular nephritis. So these are all clinical diseases, but however, going down deeper to the tissue level, that's what it happens. Basically, the symptoms, the causes, etiology, like I mentioned, could be chemicals, toxin, because kidney and liver are the major organs to excrete the toxins, either from the nature or from the medications, particular medications. Liver is the one, and also kidney. So, at the same time, those chemicals or medicines will have toxic effect on the kidneys or livers. So if it is the medication cause a kidney problem, or autoimmune, or the degenerative change, or any other causes. So I already talked about the kidney disease. Usually, if this occurs in the tubule, impaired the ions and protein absorption, cause the acidosis. If it is in the glomerulus, cause the either the blood urea or proteinuria, and then edema. So this is about the clinical associated symptoms. And on top of that, the other important or very common conditions occur in the epithelial tissue or epithelia are the adenoma or the gland. Actually, the glandular cells, folks, they are also the epithelial, if you recall. So the adenoma is benign, it's quite common sometimes, and also the carcinoma, which is the malignant form of the tumor or cancer from epithelial tissue. This carcinoma can be presented in many organs, not just the stomach, not just the commonly known, but there's some other locations like the reproductive system and the digestive system, and also the lymphatic system. They all can have this kind of adenocarcinoma, and wherever there's the glands or the endocrine or epithelial tissue there, so we have this adenoma, the chance to develop this benign like adenoma or malignant or carcinoma. So I'm going to this is kind of confuse you probably here and there, just raise up level from tissue to the disease, this kind of jumping from the base to the height of the clinical. In terms of the symptoms and the presentations, probably I already mentioned it before, but just had a link here for you to understand, and hope it triggers your interest to search more. Or if you have family history, or if you have risk factors, you need to probably do more research and talk to your physicians. I'm going to stop here today. Thank you for watching.